This comes in from a listener. What should you do if you're on the fence about spending money or investing in a compliance program? Before we answer this, I just want to make sure that everybody knows and understands this is my opinion, my advice related to certain compliance issues, compliance program, compliance department issues, and it is not legal advice. I'm not a lawyer. If you have any questions related to what your company does, please check with your general counsels, your compliance officers, and your outside counselors. So what should you do if you're on the fence about spending money or investing in a compliance program? The first thing that you should think about is compliance program as a revenue driver and not necessarily a cost center. That is something that when we look at it, a lot of people look at the compliance department as just something that you have to have in order for you to not get in trouble. But there really are ways that it can retain value for you and keep the money that you have lawfully earned in providing healthcare. Some key statistics I think is really interesting, at least from 2023. Usually the DOJ and the OIG are a little bit behind, but 2023 statistics are pretty great. For penalties in 23, the DOJ recovered $2.68 billion under the False Claims Act. HIPAA violations, they paid out about 139 million individuals. Corporate integrity agreements, there were a lot associated with what came out in 2023 and how many people went under a corporate integrity agreement. If you look at the average cost of a corporate integrity agreement for, small to mid-sized companies can be anywhere from $250 to $1 million per year on estimated cost. That means you also have to have a $150,000, $200,000, $300,000 compliance officer, other compliance staff at the tune of $100,000 to $500,000. You're going to have internal monitoring and audits. Those can run anywhere $20 to $50,000 to $100,000, maybe all the way up to $500,000. Training and education programs can cost you $25,000 to $100,000. Legal fees are a couple $100,000 as well. And so corporate integrity agreements can be very costly in and of themselves. When we look at how many exclusions were done in 2023, they excluded over 2,000 individuals and entities during that time period, as reported by the OIG's list of excluded individuals and entities. And then we have Foreign Corrupt Practices Act. A lot of people in healthcare might not have to do with that unless they're providing healthcare in another country, but they have seen those fines exceed $120 million per case. So there's a lot of there's a lot of things out there related to penalties that actually can cause a huge problem when you're talking about whether or not you should have a compliance program. Prevention is cheaper than fines, period, end of story. If you have a compliance program that is preventing things from happening, you get to keep that money, i.e. a revenue driver. It creates this competitive advantage, helps you win contracts, structure partnerships, patient care issues, patient validation, patient approval. Patients want to be taken care of by somebody who they trust and who doesn't defraud the federal government. So when you have a compliance program and the patients know that you actually have this program in place to say, are they doing the right thing? It can help drive, satisfaction and patient care. Also reduces risk mitigation. The likelihood of whistleblowers and complaints and investigations and or excluded from other federal funding programs reduces quite a bit. When we look at whether or not non-compliance is financial penalties, reputational damage, and operational risks associated with regulatory violations can be devastating to a business, and they can really, truly cripple it. Investing in an effective compliance department and really putting your time and effort into it like another revenue driving type of department is the number one way that you will be successful to tailor your compliance program for your organization. I think it's a great question. We get this question quite a bit. And if done right, if done with the right compliance executive, if done right with the right infrastructure of that program, can really lead to a strategic advantage, a compliance advantage, and overall health of the company. Welcome to the Compliance Advantage podcast. This is the place where we help at-risk stakeholders in healthcare transform compliance into a strategic advantage. I'm your host, Ross Ronan, founder of Ronan Healthcare Compliance and a healthcare compliance strategist with nearly 30 years of industry experience. I'll help you transform compliance into a catalyst for innovation and growth. Remember, compliance pays dividends. Invest today. Well, today's guest is Ericka Adler, who is a shareholder and leader of the healthcare practice group for Retzel Law Firm. Ericka, thank you so much for joining me today.
My pleasure. Happy to be here.
Tell us a little bit about your experience. I know you've had lots of experience over the years in healthcare, in regulatory business, and compliance-based practices. Tell me a little bit about what you've been doing and how your practice kind of coincides with all of those things.
Sure. So I'm a regulatory and transactional healthcare lawyer. Been doing this for almost 30 years. In our practice, we largely represent physicians, dentists, other healthcare providers, which can be practices, surgery centers, MRI facilities, DME companies, nursing homes, anyone who provides services to patients and generally bills for those services. So in our practice, we not only help start these companies, but we guide them in their day-to-day activities, which involves a wide variety of services from day-to-day type of contract work. But more often than not, we're doing transactions such as buying and selling those businesses, assisting with government investigations, helping to structure transactions to comply with the law, helping to structure compensation arrangements to comply with the law, guiding our clients on compliance with HIPAA, Stark, anti kickback, anti markup rule, and a variety of other types of laws, both state laws as well, that implicate their day to day business as well as their business plans for growth, their interactions with others, and really try to kind of guide them on what they can and cannot do. Whether they listen to me or not is a different question, but that's ultimately my goal in handling our clients.
No, that's great. Such an extensive array of specialties that you're providing to these practice management groups or physician groups or whatever it may be. Anywhere from the transaction side of it, which I think you talked a little bit about. Are you doing more buy side or sell side or just a little bit of both? Or how does that work for you?
Well, for smaller
Mhm.
providers, we'll do both
Yeah.
equally. For larger types of transactions, we're usually on the sell side. So
Okay.
we're very pro physician, pro provider. We do a lot of transactions with hospitals and private equity. So I would say the majority of the time we're working with healthcare providers, individuals, and large groups and organizations in their transactions.
When we talk about what we do here on the podcast, it's the compliance advantage, right? And what we really try to talk about, which is lends great to your history and your background, is that there's a lot of advantages that an effective, really organized, structured compliance program can bring as an advantage to whether it's a sell side, buy side, you're dealing with a negotiation or some sort of different investigation that's happening with the regulatory body. You can really create an advantage for yourself as a physician group, an MSO or dental practice, whatever it may
Right.
be, to really do create that. So having you on the podcast today and talking about what kind of advantages you've seen in your experience is going to be great. We'll jump into our questions. We have the same 5 questions that we ask all people that come on our podcast. We love to hear how every individual is going to have their own spin to these. And so we'll start off with the first one. What is the biggest misconception about compliance that you think most healthcare executives still hold?
I think that's a great question. For me, primarily, I have to say, who is a healthcare executive,
Okay.
right? Where I work and the kind of clients I work with, the healthcare executives are usually the CEO or the president of a healthcare practice,
Mhm.
whether it's small or large. I'm not really giving guidance to the CEO or executives of a hospital or a public company or anything like that. So for me, I think the misconception about compliance that the senior people working with my clients have is that there is a little bit less need to focus on it if they're not huge,
Hmm.
right? So a physician practice, for example, doesn't need to do quite as much as a hospital or a larger organization because they're so small, people aren't going to really know, right? The other misconception is that they just need to do enough, right? So maybe do that once a year, HIPAA training, or just make sure they at least have it somewhere written in their policy manual what you can and can't do. Maybe when they originally designed their compensation plan, they made sure they had a lawyer look at it. For the misconception really is that they just need to do enough. And I really don't blame them, of course, because there's so much going on out there for people trying to run healthcare businesses that prioritizing, understanding where different rules or requirements fall is hard sometimes. And so I think one of the biggest mistakes they make is that somehow compliance is not at the top of that list, right? Making money, surviving, getting better reimbursement, being competitive. Those kinds of things are probably more in their top five than compliance, at least in my experience.
Yeah, we call that stick it on the shelf, right? Buy a bunch of
Right.
policies and stick it on the shelf, and there's my in effect compliance program. And we often talk about compliance as not thinking about it as a cost center, thinking more about a revenue driver, right? How do you keep the revenue that you've done? How does it create that competitive advantage with other people? How do you talk and how do you get them to overcome this misperception when you're having that conversation with a founder or a CEO of a smaller to mid-sized practice that you're dealing with? How do you have that conversation with them to make them realize that this might not be reality for you? Reality is you have to do something here and today in order for you to reap the benefits tomorrow.
Right. I think that's a tough conversation because everything is depending on the size of the business about cost, right? And it's very hard to see down the road how they might benefit from spending money on legal fees or consulting fees for something like this. So usually they want help, but they
Right.
want to do it in the most cost effective way, or they want a little bit of direction and then they're just going to do it themselves internally, or they
Right.
want me to point them to resources that they can read themselves. So it's a little bit of a battle. They want to do it, but they don't want to do it necessarily the way I would want them to do it. And that's really kind of the struggle. We do try and direct them, give them kind of a list of resources that they could use to do as much of this on their own as possible. What I really try and do is point out how not doing it could impact them.
Yep.
Right. So, for example, if they're getting a government Medicare audit, for example, and they never did any outside audits, they never have anybody review their internal billing people. Those aren't certified coders, etc. Are they setting themselves up? Are they saving money now, or is it going to cost them more money later? Right? If they do not do proper HIPAA training, and yet they have an OCR investigation against them and they can't produce the documents they're required to produce, what's going to cost them more? Right? If they don't let me talk to them about their comp policy and fix what's wrong and make sure they're a group practice for Stark, and then they get in trouble, that's a black and white violation of a civil statute, right? That's going to cost them a lot more. But I'll be honest, the percentage of people who really I see getting into trouble for these things
Mhm.
is not huge. I mean, we have a high volume of clients and it definitely happened, but I bet when they're talking to each other, it's never happened to anyone they know, right? So they're like, oh, we're probably fine. But when it does happen, it's so tremendous and such a bad consequence. And then, of course, what I see a lot of now is when they want to sell their practice
Yep.
and all of these things turn out to be things that they should have done. And that can impact their ability to do a deal, the price they get for their practice. And then, of course, the self disclosures they might have to make. The worst case scenarios where they don't take something seriously, but someone else in their practice really does. And then we get a whistleblower lawsuit. So I really try and point out all the ways it could cost them more not to do something. But it doesn't, it's not like they ignore me, but they still want to try and do it on their own, I would say.
Of course. And we just did a lot of statistics in trying to research the advantage that a compliance program will do. And we came up with some numbers from an institute that did a research in 2023 saying every dollar spent on compliance saves you about $6 in fees, fines, penalties, legal expenses over the year. And this was a study that was done. And if you think about that, the $100,000 you spend on compliance saves you
600,000.
$600,000 on the end of
Wow.
it. Like, would you
Right.
spend 100 to save five? I would do that in a heartbeat.
Yeah. Send me the article.
I
I'll
will.
share
I
it.
will. I will. I will. I love it.
This episode of the Compliance Advantage podcast is brought to you by Ronan Healthcare Compliance. At Ronan Healthcare Compliance, we believe in transforming healthcare compliance from a checkbox attitude to a strategic advantage. With decades of expertise, our team of consultants provides innovative solutions tailored to your organization's unique needs. We don't just help you meet your standards. We elevate your business, ensuring ethical practices are at the heart of what you do. Whether you're navigating complex regulations or seeking to enhance your compliance strategy, Ronan Healthcare Compliance is your partner in achieving excellence in healthcare compliance. Ronan Healthcare Compliance, redefining compliance, empowering leadership. Visit us at ronanhc.com to learn more. Now, back to the show.
But I love
Yeah. I mean, those real numbers are impressive. I just think people imagine that it's never going to happen to them. And there's people doing worse things than they're doing, right? And they're doctors, not business people very often. And so they just want to focus on patient care. I get it. Healthcare is it's so wrapped up in administrative hassle and regulations. There's just one more thing on their plate. And I understand how it can be overwhelming.
Absolutely, absolutely. If you could change one thing about how compliance is perceived in healthcare, what would it be?
From my perspective, the perception about compliance amongst my clients is that it's important, but not that important.
Mhm.
And so, if there is something I would change, it would be to move it up the list in terms of priorities. And what I see is a lot of emphasis on cost savings, obviously, reimbursement. We even see data about how much different doctors are making in different specialties in different regions. I would love for them to have access to see how many doctors are getting in trouble for doing certain things in their region, in their specialty, what those things are, because I think that would really be a red flag to them that, oh boy, you know what, maybe I better have somebody look at it, or we better redo our education. We better get an outside audit. So for me, it would be the prioritization of compliance. And I know it's a pain and nobody likes it, but it is the standard of care. And I think doctors need to think of it that way.
It's so crazy because you think about the true numbers of people want to think about compliance as being HIPAA, as being kind of all these other things. Well, False Claims Act violations, which everybody has to deal with from
Right.
a billing perspective, what $2.6 billion were recovered in 2023 by providers for false claims. I mean, that is just an astonishing amount of money that is paid back to the
Right.
federal government because people don't do the right thing or don't really know what they're doing. Here's a follow-up question to that. You talked a little bit about you seeing it from the provider side. Is there anything that you can see about a compliance program in and of itself, the compliance officer, compliance executive, whatever it has done? Is there anything they've done to create a perception of, how it's perceived in healthcare? Because I do think that at some point in time, compliance officers have a little bit of a burden to bear on how this is perceived, right? From day one, someone told me the other day that I was a Gen 1 compliance officer, which A, that makes me seem really old. B, yeah, I've been around a long time and when the regulations came out, but even back then, compliance was seen as a hammer looking for a nail, right? Just walking around trying to beat people into submission to say, do this thing because I'm a compliance officer. I've been deemed by the regulations as an officer of your company, and therefore you shall listen to me, right? Do you feel like there's any kind of piece of a compliance program who may have created that kind of perception within your clients?
First of all, very few of my clients will have like an independent compliance officer unless they're significantly large. Sometimes they do a crossover where the person who's the compliance is the HR person or the office manager.
Mhm.
So I feel like sometimes they're using people who really don't have the expertise to be able to call themselves a compliance officer, who sometimes maybe try and use it to act more powerful than they should. And instead of being partners with the practice and the providers to do certain things that are preventative or problem solve. Instead, they use it as a punishment tool, or they use it as a way to like report people. And it just creates a kind of a negative feeling about compliance, and which it absolutely shouldn't be. I mean, everybody needs to work together. We all win or we all lose, basically, right? So I think it's a lot about how that position is created, the person who takes on the role, the effort they go through to become knowledgeable, and the authority they have, and then how they are regularly interacting with people. I've seen it done well. I've seen it done very poorly. There are some people who call themselves compliance managers and they know nothing. It's just a title to them, right? And obviously that's not the case for you and for real compliance managers, but in a small practice, you sometimes just get the title and you went and you took a course on it or something, or you read a couple of books, or you needed to identify somebody in your HIPAA compliance plan as being the HIPAA officer, right?
Right.
So you got it. It's your title, right? And to me, that's not really taking it seriously, but in all honesty, sometimes that's the best they could do. And the question is, if that's the kind of person who's going to be in that role, how do we improve that title, that improve that role? I like to work with my clients, so it's kind of a collaboration with the legal team.
Yep.
We can help that role be more meaningful. We can help educate them. We can help them protect themselves and deal with situations as they arise. So it can be okay to introduce someone into that role who wasn't naturally educated or experienced to be in that role, but they need backup and they need support and they need to kind of understand it's serious. It's not just a title, right? And I think I would love to see more people handling compliance officers and compliance titles properly. But I think in a lot of cases, it's just poorly done. And it's like anybody who's not qualified suddenly getting a position above everybody else. It creates bad feeling about that person. And they never even get a chance to really do the job they could have done. It's just viewed very negatively. And so I think it's a self-fulfilling prophecy, right? They could have done a great job, maybe. They never got a chance to do it. And it just kind of makes compliance go even further down on that list of priorities. And people don't care and they don't want to talk about it. So I think it's a whole mess at that point.
Definitely got to fix that perception, and we got to fix that piece of it. And I, appreciate the fact that you guys go down that road too. We call them compliance executives. We don't call them compliance officers, just because you need to act like an executive, and then you can actually
Right.
realize how you can be a strategic partner. When we
Right.
talk about the compliance advantage, though, is there a moment in time, especially working on the transactional side of this, and I doing so much as you do with sell side and a little bit of buy side. In those who may not know, what sell side is getting someone ready to go to sale, for sale, whether it's
Right.
private equity, VCs, some sort of strategic roll up that can grow from. When you think about that, is there an aha moment where you're just like, wow, they have a compliance program, they had it in place, and it has created X, Y, and Z?
For me, that is like the best moment. And it's so rare. When we're doing a transaction, there's always that phone call with the due diligence team on the buyer side. Typically, they have counsel just for that. And we start running through the list. And do you have a compliance plan? No. Have you ever had an audit done? No. Do you have anybody who has ever reviewed your compensation formula? No. Do you, do you know what the rules are for incident to billing? Rules? What? To me, that is like the worst moment. So when I'm on that call and I hear, oh, yes, we already uploaded it to the data room. Yes, I am actually the compliance executive and I work with our legal team on this regularly. We have a committee that does it. We have outside audits every 6 months. When we hire someone, we run them through the OIG database. Like when I hear things like this, it is such an excellent moment for me. They did a great job, but it's not just about a good moment. Like that kind of experience is the make or break, and whether sometimes a deal is going to happen or not happen, whether they're going to end up losing some of the potential purchase price, whether they're going to end up spending a whole bunch of legal fees on us solving a problem that we only discovered during diligence. So it should be an aha moment for everyone that this is a great practice to buy. They've done everything right. And that's really, it doesn't happen that often, but when it does, it's sweet.
It's amazing when you can walk to the table with your gold ribbon on there, your some sort of medal, go, yes, I've done this before. And like you said, I've been a part of as a compliance officer, going public, being purchased by
Right.
big private equity groups. And our due diligence calls from a compliance officer standpoint on these huge multi-billion dollar deals where it's uploaded. Here's our executive committee reports. Here's our policies, because full transparency, there it is. Let me know if you have any questions. And like we had the littlest amount of due diligence on these huge deals because we just had all of our stuff together. It's so nice to go, oh my God, you have this stuff. It's so good to know that, right?
Right. Yeah. I don't think anyone outside this area would appreciate that. That's like such an awesome feeling, but it's like almost like a relief. Like it's the worst news to tell someone you really screwed this up.
Yeah.
You didn't never did this. You were doing this wrong. You were doing that wrong. You didn't comply with this law. All your contractors should have been employees. You build this wrong. You have all this money you have to refund. I mean, it's terrible news when just one thing after another, I'm like shaking my head. Oh, yeah, we give annual gifts to our best referral sources. We don't have written leases. When I just, the list goes on. And it's just like, it's could have taken so little time and effort and money to help them be compliant, at least more compliant than they end up being. And that's part of what we were talking about before. Like
Yeah.
it's so worth it to just get it right from the start. And even if you haven't done it right, we can help you fix it. And then when you're ready to go, you'll have a better phone call on diligence. Yeah, that's the best moment, really.
I love those aha moments. All right, this one's a fun question. I like this one. Everybody struggles with it a little bit, but I love it. So, if compliance was a superhero, what do you think it would be in your eyes?
Yeah, this is kind of a tricky question. I'm not a big superhero person, but I would say that the powers I would love for a superhero, I don't know if it's a Wonder Woman or
Hmm?
Superman or what it would be the ability to have that X-ray vision to see what is really going on. You got a great looking practice, great revenue, but with that eyesight, I can see, you know what? You guys are paying yourself improperly. You're not doing this right or that right. I'd love to just be able to kind of see everything that you're doing wrong with a one stare, right? And the other thing would be those like awesome wristbands to deflect all the things that you did do wrong so that we could immediately push them off to the side and not have them stick.
Hmm.
Right. And that's really it. Being able to see what's there and being able to prevent it from hurting you. That's really what compliance is all about, right? There's the preventative part of it, but I guess I'm not aware of any superheroes with preventative skills, but that would be pretty excellent as well. Maybe even speed. We go back, fix everything, come back and continue the conversation on compliance. Having fixed everything would be great as well. So,
I love it. And we do talk about some of those. A lot of people say, look into the future. What's it going to look like down the road? But with your perspective of trying to fix things pretty quickly and make it right, see where you might not be able to see the prevention, detection, mitigation aspects of a compliance program. I think the reason that we ask this question is because it it's not necessarily a superhero task or feat that can be done. It's something that we can do every day if you have a good compliance program to
right,
create that competitive piece of it, saying, I
right,
am taking care of it. It's not about that it happened, right? We all
right,
know that. Things happens all the time. It's not if, it's when. We all say this stuff, right? It's about how you deal with it and how you mitigate it and how you prevent it from happening in the future. And those are the
right.
conversations that you have with the
Yeah,
OIG and the DOJ is, this is what we did. This is how we're going to prevent it. Yeah, here's your money back, and we're not going to do it again. Right? That's the
right.
biggest piece of it.
Yeah, I mean, I actually think with a good compliance plan, I don't need to see what the future is. If I've done my job,
Great point.
I don't need to worry, right? I mean, things may not go right, but I've got the process in place. We've got the knowledge. We know how to fix it. We're catching things because we have plans in place. So I'm not too worried about the future. I'm really just worried about what happened before I got there and what we're doing now. For me, that's really key. I can't plan for the future.
Great. No,
I'm
that's a
into it.
great point. That's a great point. If I can see it now, I don't need to look in the future because I already have my processes in place. I
Right.
love that. Love that. Love that. We talked about this a little bit already when we first started, but kind of either reiterate it or if there's a different perspective, what advice would you give to a CEO that you deal with every day, a founder, a board member, someone who's getting ready to sell, someone who's on the buy side of it? What advice would you give them about fostering a culture of compliance? And how do they push from the top down, lead from the top down, and figure out how they need to have that culture of compliance? What would you tell them?
Well, I think for an effective compliance plan, I like to see involvement of everyone. And I have found that for groups that they have somebody in charge, you always need to have someone at the top. I like to see them involve legal counsel. And for some of my groups, we go in and we talk to them about different scenarios we've seen in other practices. So they see what's going on, that they're not immune. It could happen to them. But then I like to see them appointing different people in the office. It could be doctors, nurses, billing coordinators, etc., to be involved and take charge of either the training in a particular area or the follow up on particular areas, and then have meetings where we come back and report on things. Right? I feel like there's engagement, and people like the idea that they're responsible and in charge of certain aspects of things when they feel like they're the ones that are going to have to explain why they did or didn't do something, what they did or did not find, right? When we've done an approach like that, I feel we get much more buy-in by the people in the practice, and they care more, and they're at the meeting. And it could involve having them go to some kind of educational event and then report back, or being in charge of bringing an auditor in to do an audit. And by sometimes we do those through legal counsel for privilege. And so sometimes the nurse might be on the phone and we're talking about what kind of charts we want them to look at, how many charts, how often are we going to do it. And they feel involved and they care more. And then when we see the statistics, we then sit down and we talk with the doctors about what we found. And we're going to do it again in 6 months. And for example, things like gift giving, especially around the holidays, we talk about that. And somebody's in charge about somebody's buying those gifts at the holiday time. So that person is in charge of every year finding out what the rules are, what the maximum amount is, what they're going to do to show gratefulness for the past year. So I think finding the involvement of people in your practice and not just telling them what to do and then getting them in trouble when they make mistakes or screw up, right? I think that way people really feel more involved. And obviously, we're always worried about that one person who might be just kind of keeping track of things they find wrong in the practice, who's going to be a whistleblower. I've had that happen in several of my practices, that snitch, right? And instead of wanting to help make the practice a better place, pointing out what they saw, even when everything is set up to invite them to bring concerns or to point out things they see, they view it as a way to either make money or to get people in trouble. So that's kind of what I feel I'm fighting against when
Sure.
I'm working with my practice to help build a program. And so we've got to have everybody in there where they're not just trying to do what's great for the practice, but they're also somewhat keeping an eye on each other,
Yeah.
right? Making sure nobody is doing things that harm the practice. And I got to say, getting rid of people, which is an unfortunate part of anyone's job, but
Mhm.
I feel very strongly that there are people who don't care about compliance, who won't buy into it, who pose a threat, and they need to go. I don't think that's good for the practice or for the culture. And I think part of what executives need to do is kind of coordinate with HR and make compliance a very key part of getting rid of people who are bad for a business or for a practice. And we try and tie all those together, whether it's completing accurate records in a timely
Mhm.
manner or reporting HIPAA violations. People need to be reprimanded and there need to be consequences. I can't tell you how many, oh, but she's such a good worker. We talked to her about it. She's not going to do it again.
Been here
That is a
forever.
that happens again and again and again, and it's so frustrating. Or they let people go and then the person just goes on and works at another practice, does the
Right.
same thing, right? I am all for consequences and having to be responsible for your actions. And I probably sound like really just the toughest, meanest person right now, but I'm the one they go to when there's been a problem and they need to address it. And the biggest mistake I find is that people never talk ahead of time about what the consequences should be for not complying or for blowing off HIPAA compliance. I've had people in a practice just look at their co-employees' records. Okay. Why aren't they terminated? Why aren't they disciplined? How many times has it happened before they're terminated? Right. I've
Right.
had people repeatedly using modifiers when they're not supposed to, doctors, and they're told, stop doing it, stop doing it, stop doing it. But they make a lot of money for the practice. Right.
Sure.
And so everybody is looking over their records repeatedly, creating a whole extra job for someone instead of there being consequences. So practices have to decide what is important to them. And unfortunately, as we've already talked about, compliance is not as high on the list as making money is, right? Or keeping those talented doctors, which of course it's a hard call, but I think these all need to be as important.
Yeah, making money and keeping money should be in that same conversation, in my
Right.
opinion. Because if you make a lot and then you give it all back, then it's not really very helpful. And it is funny that you talked a little bit about how the leadership can affect that culture of compliance. I had a conversation with a potential client the other day, and we were talking about doing a risk assessment. And part of that risk assessment was doing interviews with the leadership, right? And they said to me, I might not have you talk to the leaders. I probably want you to talk to the second level people because they're dealing with compliance a lot more and every day and blah, blah, blah. So they'll probably have more information. I said, if that is the case, then we have a problem here with your leader because I should be able to go to them and have a conversation. Tell me how compliance works for you. Tell me how you see it. And if their answer is, I don't know, I don't pay attention to that, then you have a culture problem. If the answer is, they're great, they're wonderful, we deal with them every day, talk to my people, I love what they do, blah, 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 then we've got a compliance culture, right? So it was a very interesting conversation. And she was like, oh, well, that makes more sense. I'm like, yes, that's how
Right.
we look at it. So
Right.
it's great,
Right.
great.
No, absolutely. Everybody needs to be on the same page. I mean, you could have different areas that are falling within your purview,
Mhm.
right? Like
Yep.
maybe it's billing or maybe it's HIPAA or maybe whatever, but everybody's on the same page that there's 100% effort in compliance. And we know what the consequences are if people don't comply. And this is how often we're going to meet to talk about it. And these are our goals, participation wise or accuracy if we're doing coding audits or whatever it is. So I think it's like a checklist like any other. How much money did we make last year? How can we reduce our expenses? How can we reduce our risk? It's important. And the top people have to be the one that send the message that it's a priority.
Everybody else will follow. One last question. Appreciate your time today. We always say health is wealth. And in this industry, whether you're a lawyer, you're a compliance, you're an executive, you're a CEO, you're a founder, you're a board member, you got to take care of yourself. What do you do to take care of yourself? People want to know a busy lawyer who's been there for 2 decades and you're dealing with all of the things that you deal with. How do you keep health, wealth, and wisdom?
Gosh, wow. I think I take care of myself by turning off my phone, turning off my computer, and trying to turn off my brain, which as a lawyer can sometimes be a hard thing to do. I think separating myself from work and my clients' problems for some period of time to be with my family, doing things I enjoy, focusing on their issues or whatever is going on is really, the best thing I can do for myself and for my clients. I mean, being immersed 24/7 is just too much, right? So we all need to take that break. And I think if I don't, then I'm probably not the most effective leader in my own practice with my colleagues and I just get burned out from hearing from clients about what's going on. Like we all need to just sometimes turn it off, right?
Absolutely.
So,
Absolutely. Well, Eric, thank you so much for joining us today. Really appreciate the conversation. Great insight across the board. Loved hearing about your clients and how compliance really is an advantage for you all. And your insight was tremendous. So thank you so much for being here.
my pleasure.
Thank you for listening to today's episode of the Compliance Advantage podcast. If you enjoyed it, please rate, review, and share this episode with someone who might benefit from it. Don't forget to visit us at ronanhc.com for more resources and connect with us on social media for the latest updates. And remember, compliance pays dividends. Invest today.